All right, well, thank you all for attending today's Translational Science seminar session presented by Dr. Heather Stuckey on qualitative research methods in translational science. I just would like to give Dr. Stuckey a proper introduction and let you know a little bit about her background. She is co-director of the Qualitative and Mixed Methods Core at Penn State College of Medicine. She has extensive experience in qualitative research, including several grants related to qualitative research and understanding the meaning and behaviors of diabetes. She was lead qualitative researcher for the Completed Diabetes Attitudes, Wishes, and Needs international study involving 17 countries. She established procedures for coding more than 100,000 words of qualitative data regarding successes, wishes, and barriers to those with diabetes. This included supervising qualitative coders to achieve inter-rater reliability and negotiating meeting of cultural and political climates in the text. At the Qualitative and Mixed Methods Core, she has helped to design and implement over 60 studies. She's trained qualitative researchers in nearly all departments of Penn State Health and conducted training for focus group facilitators in preparation for completion of NIH, PCORI, and internal grants. Dr. Stuckey is course director for the Public Health Sciences Qualitative Research course. And so thank you, Dr. Stuckey. I've actually had the pleasure of working with you on several of our research projects throughout my course here at Penn State College of Medicine, and we're just delighted to have you. So with that, I'll let you take the lead.
Okay, thank you very much. Because I don't know my audience completely, I have some information in here that's more basic and then also more complex relating to qualitative research methods in translational science. So with that introduction, the goals for today's session basically are to provide examples of research questions and what type of research could be done in translational science, describe the basic steps of what would be involved in creating a qualitative study, and then we're going to have some time for questions at the end. So qualitative data, for those of you who might be new to it, is basically can be expressed mostly in words in our translational work, but there can also be audio, video, observational skills, and it answers the question of basically how or why. The questions are open-ended in nature, and they typically are more like, how did something happen? What was your experience? Really getting to the participant's point of view. That's basically what qualitative research is all about.
There are no slides showing for the group.
Yeah, Dr. Stuckey, it looks like it's stuck on that title slide.
Is it really? Okay. Well, then let's not, let's try something else. How's that sound?
I wonder, do you have maybe the presenter mode?
It says we're viewing Heather Stuckey's screen.
Sometimes for me, if I stop sharing and then restart, Dr. Stuckey, it
should I do that?
Yeah.
Okay. Sorry about that. You never know, right?
We're excited to learn from you.
Okay, great. So let's try this. Let's see what happens now. One moment. Yeah, so there's a lot of, I just want to tell you while I'm doing this, there's just so many ways in which we can use qualitative research. And so I think that using it in translational science is really, one of the best ways to be able to use qualitative research, because it's all about, centering in on that patient experience. So, yeah, I don't know why I'm having a few issues here, because now it's not allowing me to do a slideshow, which is so weird.
Dr. Stuckey, do you want me to share on my screen and I'll just advance for you?
I guess we'll have to do that.
No problem.
That seems ridiculous, but yes. Okay, that's fine. Thank you.
No problem. It's opening.
I don't know why.
Now.
Yeah, we never know. I'll just give you like I'll do this and I'll let you know that it's the next screen. Please do. My apologies.
No problem.
Who knows why it's not advancing? It's advancing for me. Great. So the second one was basically then just the objectives of the session. So I think we've got that. The second slide. Yep. And then these are the goals of qualitative data. So this is where I was at, and you can actually put all of them up. So, words, they're asking about how and why, open-ended, and then the goals of qualitative research are really to generate some kind of meaning, to understand or contextualize a phenomenon that cannot be answered in quantitative terms alone, and really about pursuing opinions and experiences, perceptions of how people are viewing an intervention or a seminar or evaluation techniques. So it's all about getting feedback from a participant regarding the research question that you have in mind. It's a rigorous project that results in themes, and sometimes a whole conceptual model will develop. I'll talk about that later. Okay, so qualitative research is not easy. It's very different from quantitative research. We have a qualitative and mixed method score. So sometimes the qualitative research supports the quantitative research, sometimes it's vice versa. But it really is a different way of approaching it, because it's not just random, it's not just sloppy, that it takes a lot of rigor, and there's data trails and those kinds of things to determine how the data were collected and analyzed. Because it's considered subjective in nature, it's important to keep those audit trails, and we have certain rigorous projects or processes in mind to be able to help that. It's not individual. It requires a team effort with multiple coders, multiple individuals. So it's not typically just one person going out and doing the work. I became a qualitative researcher. I was interested in diabetes research and have a postdoc in endocrinology, and was very interested in understanding more about people's A1Cs. A1C is basically the 3-month period average of blood glucoses to see how people are doing with their self-management of diabetes. And so people were coming up with high A1Cs that would be, kind of anything above 7. They were, we found people who were 9, 9.5. And I just said, why is this? Because they seem so compliant. They come to, the visits, they're adhering to their visits. They're really great people, but we don't understand a lot about why that A1C is high. And so the very first study that I did was actually just understanding through observations, what are people's interests and in developing self-management skills. Is it an educational issue? Is it an access issue? Wound up going into people's homes and looking in their cupboards, and what they said during the interview and what they had in their cupboard was very different. And you might say, well, yes, it's for family members or something, along those lines. And yes, indeed, we did parse that out to figure out, well, what is the foods that you eat and what are the foods that they eat? And it was just really interesting how observation was able to add to that knowledge. And by talking to these individuals, we just learned, where is the specific barrier? Sometimes it was, quote, my wife does the cooking for me and I can't really control what she cooks. And so by talking with the family and getting an idea of, what is happening, we were able to understand more about why the A1C was larger. was high. We also had an issue where the A1C was actually pretty good. It was like 7.5, but the individual was experiencing a lot of highs and lows, roller coaster. So by learning this, we were able to figure out the quality of life was low. And we thought, why is this? Because their A1C is pretty good. So it's well beyond the A1C or well beyond numbers. And that's where the qualitative piece came in. Great. So the qualitative research is particularly relevant to clinical and translational science because it's research aimed at translating or converting quantitative or basic research into results that directly benefit people. The way this connects is because qualitative research is research aimed at collecting people's experiences and perceptions to analyze what happens in the real world application. I took this from the National Center for Advancing Translational Sciences, and what it is a translational science spectrum circle. Around the circle are 3 different areas: developing new approaches to the way that we do things, demonstrating their usefulness, and also disseminating findings. Qualitative research could be used in any one of those aspects. Maybe you want to, for developing new approaches, perhaps you would want to, ask a group of stakeholders before you develop an intervention or something that you want to try out differently in your office, or you want to try a different type of treatment. You may want to ask the individuals who are receiving this treatment or who are in your office to find out what they think about that. And so that's where this center of patient involvement comes into play. So that would be a way that you could use qualitative research there. Demonstrating their usefulness could be done certainly quantitatively, but also qualitatively in asking, what did you experience while we implemented this? What do you think are some of the ways in which this could be improved? How do you think this could lead to an intervention? These types of questions would be things that qualitative research may help us answer. And lastly, disseminating findings, finding out qualitatively again, well, what is the best way to actually distribute this into the community? We want to go beyond, let's say, your typical journal article. We want to reach a larger audience. We need to ask community members, leaders in the community or in another organization, how do you think we should best disseminate these? So these are all critical areas within qualitative research to explore. So I just wanted to show you how it fits in with the translational science spectrum. So here's some research questions that I made up that are related to, that you may ask for qualitatively. So we have the quantitative measures that we know that patients with sleep apnea, we know that they're recommended to use a CPAP to increase the air pressure inside their airway when they inhale. So we know this scientifically. We've run quantitative studies on this. But some patients don't use it. And, you think, well, this is available. Why not? Well, there are some data that show us why people are reluctant. But we may want to ask people in our clinics, well, what's your experience of using the CPAP machine from the perspective of the patient? Is it loud? What's happening? What makes you successful? What could we do to help you improve? Could we, can we problem solve together to come up with a solution? Maybe it's your loved one who's complaining and, about it. And maybe that's somewhere where we have to just talk about that to be able to, help to improve adherence. On the next slide, we have another area where we could use a research question in qualitative research. And this is patients with, let's say, uncontrolled type 2 diabetes, or let's say a higher A1C. For type 2, we know that maybe insulin may be the next level of treatment after oral medication fails. That's treatment. We understand that. There's American Diabetes Association guidelines that are based on scientific quantitative data. But now we want to understand, why aren't our patients going on insulin, even though the physician recommends this? This would be something that could be explored qualitatively. And what can be done for people who are resistant to go on insulin? So, maybe there's someone who just says, I don't like the needle. But, if we problem solve with them and be able to talk about that, we can find out perhaps that it's really not the needle at all. It's the fact that they didn't understand how big the little or how small the needle actually is, and that it wasn't quite as bad as they thought. So, this is just an example. Then I have an example from the literature, and this is Shea et al. This was a study that was one of the 72 articles that I saw in the Journal of Clinical Translational Science. So after putting in these terms, I picked one that was interesting. The research question that was in this literature was that they were presenting this CTSA program, and they were strategies for diversity, equity, and inclusion presented in this formal education session. But their research question was, what did participants think of this program, but what did they also think was missing? What would have they included that wasn't there? This was the first time it was developed. So how could the program be improved to be more relevant? The next slide shows the results of this, where they said that in addition to the 6 strategies that they talked about during the session, there were 4 other themes that were interesting to advance diversity, equity, and inclusion. And those included institutional buy-in, recruitment efforts, the whole application process, and mentorship. There were illustrative quotes that described how and why these new themes were important to implement. And what will follow after this in the future research section that we always have, it will be, now you need to figure out how each of these will work within your own organization. So mentorship, for instance, that may require more qualitative research to figure out, okay, how can we better, help those who are underprivileged to be able to have the same access to, faculty salaries and recruitment, something like that. Whatever that is as far as mentorship may mean, we would have to probably have more qualitative research to understand how to actually implement that. But these were 4 different things that now they're going to include in the program, because they were themes that came out of the literature, or it came out of this focus group or several focus groups that they did with this CTSA program. All right, so I've been talking about qualitative research and what is it, but the big picture of what we typically do, and this could be expanded, but what we typically do is we get the IRB on board, the Human Subjects Protection. Then the data collection process, the data collection in this case is almost always interviews for us in public health and for translational science. Usually it's some kind of interview to talk to the individuals. And so there has to be a very clear research question that comes into play. The reason this is so important is because the interview is going to be guided by that research question. So there may be an interview guide if it's, 45 minutes long. You think that's how long it's going to take. There might be 8 questions that you want to ask individuals. They all have to relate to that research question that you have. Then you go about collecting the individual interviews and recording them for transcription. That transcription becomes a document, which then we code. And I'm going to talk some more about what that coding looks like and what is that. So this is the big picture also. We have coding, we have categorization, and we have themes. So whenever we are thinking about implementing a project with qualitative research, and we have the interview questions set up, which we can always help you with. Yes, okay, I can talk about that. Do you want me to take the questions now or at the end? Did we care, Ellie? I guess at the end.
I was unmuting. Whatever your preference is, I would just recommend we are recording. So if you want to say those questions out loud when you're answering, okay, that'd be great for the recording. Whatever your preference is.
Okay. Well, I'll go through this piece and then I'll be able to answer some questions, and then I definitely will answer questions at the end. I'll leave plenty of time. Okay. Thank you for asking these questions. So, so I was talking about codes and categories and themes. The qualitative codes that we assign these are basically like tags or hashtags that you might add to a video that you saw. They're very simple words that we attach to make meaning of the bigger picture. And when you cluster them together, they form a category. So like maybe we would have negative emotions as a category. And all these individual interviews that we've had were codes of maybe, frustration at diabetes self-management, or difficulty with new technology that, that makes them angry, or any kind of negative worry about hypoglycemia. Those would be more like codes, those individuals, and then those individual words or phrases, and then that would fit under a larger category called, in this case, maybe negative emotions. That actually facilitates the development of these categories, and these categories are then thematically organized. The next slide will show us a little bit more about that. So we'll talk about this coding, all right? So it's a unit that helps us to sort of label and collect data in a simple phrase so that we know what do we think this text is saying? What do we think the person intends by saying this? What is trying to be conveyed by them? What is happening? What are the events that are informing this way that this person is stating this, this response? These are questions that we think about as we're coding our data. We then take those codes that we have, all these scattered codes, and we say, okay, now if we were to look at all these codes, these words, these phrases, how would we categorize them into a larger framework? So what would be the, what would be the category for it? For instance, if we had, well, in one of the other slides that I'm going to show you talks about BMI management. And so we clustered all the barriers and all the facilitators together, and those would be considered categories. And then these codes and these categories become a code book, and that's from which we actually code the data. The elements of a code book are the three elements: the categories, the codes, and then the definition of each code. This is an example of what a code book might look like. And this is the barriers to BMI management that I was talking about. The research question for this was basically, why are some of our patients very successful in losing weight using this one intervention that we had and others are not? Well, so we looked at what are some of the barriers and why were people successful, and what were some of the facilitators that were helpful for people. So you can see the categories they're the larger set. The subcategories are even divided a little bit further. And then the codes are the unit to which we actually place the data and all of the information that we have, all the quotes that we have that relate to that code gets placed underneath that code in our management system. The coding dictionary is a description of what that code means, so that if someone else is coding the data, you know what goes into that. I briefly just touched on software or our management system. Typically, I use a management system. We have at Penn State, we have two kinds of management software qualitative systems. One is called Max QDA, and that's relatively not real new on the market, but it's newer than the other one, which is NVivo. And both are used within the organization. Max QDA is a little bit easier to use, but I find myself being more of an expert in NVivo at this point, because that's what I grew up with, that's what I learned with. So I'm more familiar with that, but you can use that. If it's a very small study, you certainly could do just pen and paper or use an Excel spreadsheet to organize your codes and categories. But it's more difficult to get it published if it's done that way, because they like to see that it's done with qualitative software. The only thing is, the qualitative software does not automatically code for you. It can do some certain things that are that make life easier, but it also is really a file management system. So when you have all these data, it just is helpful to have a way to organize it all. And then you can click on a code and you can see, what did all 50 participants say about this? Or what occurred most often within the data set. So after we have this code book done, I wanted to talk just a moment about inter-rater reliability, because this is something that is now expected. We've been doing it for quite a while, but to get a journal published, you have to talk about how you came to agreement that if this person were to code a segment of data and this person were to code a segment of data independently, how did they understand the code and the way that it was used? Are they looking at the participants' data in the same way? And so what you're trying to do is get agreement between coder A and coder B. You don't need to code the whole thing. Only 20% or approximately 20% is enough, a fifth of it, because we want to see if we want to have enough that we know that the gist of the coder A and B are in sync, but we don't need to do the whole thing, because the point of it is if coder A and coder B agree, then one of those coders could do the rest of the 80% and not have to double, have two coders do the same set of data. Sometimes we do have that happen when it's an NIH study or it's a study that has rather lots of money. But you don't have to do that, because the whole point of doing this reliability agreement is to come to that point at which it's a 0.7 or 0.8 is achieved. So that's a kappa. And it's a lot easier, again, to do in this software management system than it is to do it by hand. It's totally possible. But it's really, it's a little bit more than just the percent to which you agree. It's also, the kappa takes into consideration the possibility of how much this would have happened by chance. So it's it's not a complicated formula, but it does take a lot of time to do by hand. So we do recommend that that this be done again with software. So what happens next? All right, so here we have these themes, right? So what are they? These codes identify all this interesting information that you're getting in your data, and then we're putting them in a cluster, right? But the themes are much broader than just reporting on just saying the category is what is the theme. So if we had there like in the other one, the facilitators of BMI management. That is not a theme. The theme would be perhaps that the factors that were leading, the leading factors to the BMI management, were the reasons they were successful, are because they had accountability and were weighing in with that partner. Something like that. Okay, so that would be more of a theme. If you just say facilitators of BMI management, that doesn't give you a lot of idea as to what's happening with that. It doesn't share, you can't just, you don't know what's really in the meat and what's forthcoming within the theme. So we may have to look across codes to determine the relationships between. So that's where a lot of people have trouble, is in thinking about this thematically. Now, there's different kinds of thematic analysis that are available. We have content thematic analysis, which is honestly more of a recapitulation of, or recapturing of what, let's see, an example of this would be, how many times did people say that they, let's say we were looking at a survey. Okay, this is another way qualitative research could be done. Let's say we're looking at a survey, and before we launched the survey to the population at large, we went to see if the readability of the survey is appropriate. So we get a couple of focus groups, or we get a couple of individuals together, and we decide that we're going to walk through the survey together, and we're going to do what's called like a cognitive debriefing, where they talk about the survey question, and we find out from them, does this make sense? Are you able to understand it? What do you understand that this means? And then, would there be anything that we're missing from this survey? That might be types of questions that we ask during a cognitive debriefing. We don't have to do a full thematic descriptive analysis of that, because really what we want to find is how many people, really said this thing, and how did they say it, so that we know how to implement it, which is why we do more than just collect quantitative data on a measure like this. We need to talk to individuals, figure out why they would improve a survey instrument, for instance, figure out where the difficulties are coming up in translation or understanding. But we really don't need to, it's not a thematic big picture thing, such as, what are the barriers to BMI management? This is really very specific. What did people like and dislike about the survey? So we might do a content summary, which shows us still the codes, the categories, the coding dictionary, all of that. But we pay a lot more attention to the number of times that something has occurred, because we want to know, okay, is this a big issue that many people didn't understand this one particular question that we really need to review? And then you can click open on that code and see what people said about it and how they thought it should be reviewed or edited. So that is one way that you can also use qualitative research. So summary coding is used when you're really focused on, it's a very pinpointed question and almost binary in nature, like what did someone say about this? Then there's also, in addition to that, the next one that we use a lot is, I'm going off a little bit on this because I didn't have a slide specifically for it. But the other way that we do this is descriptive thematic analysis, which is what we use a lot of. And so this is where this one quote comes into play, really. Because the data between these themes, when you're talking about a thematic descriptive analysis, they should cohere together meaningfully. So you don't just want to throw two codes together that, seem like they, cats and dogs. You want to make sure they're breeds of cats, right? You want to make sure that they cohere together meaningfully. But within that theme, okay, that's where the coherence happens, but it should be distinct from any other theme that comes up so that there's not an overlap. And what we do when we're actually writing these data, then what we do is we take the thematic analysis, we see where the themes are. Let's say there's 3 of them. And we go back over the data and we try to say, okay, now, if I am, these are the codes that I think fit underneath this qualitative category. These are the things that under this qualitative theme, we go back and we look to make sure that all those codes do encompass the theme and that there's not a lot of overlap between those themes. So we actually have the codes kind of justifying the themes. So that's how we go about doing that. The last slide, which you don't have to show, was about the qualitative and mixed methods core that we have. I wanted to talk a little bit about that because we are a fee-for-service qualitative core that's open to faculty who have a research project and are considering using qualitative methods. You can have the first consult for free. It's totally on us to see whether something that you're proposing, either a grant or a manuscript or a project itself, if that is something that the qualitative and mixed methods core can help you with. Can we help you with all those areas? Can we help you develop an interview guide? Can we help you develop a code book? Can we help you develop can we help you do the transcription? We send those away. So if you have a project that you think that you're thinking about, or a faculty member who is, you can contact us. We'll give you a budget on how much that would be, but we guide you through pretty much every step of the way of a qualitative project. So my main role on the qualitative and mixed methods core is to provide the study design options and to really get you to think about your research questions so that it's strong. Because I think with qualitative research, the only way that you're going to get really strong data is by asking strong questions. And so we need to work together on that first part, usually with someone else, to be able to talk through the interview guide and see how things go. And then the transcription we can do. We have an agreement with actually 3 companies now to be able to do any kind of transcription that's necessary. And then we also can help with the thematic development. So I just wanted to make sure that there was plenty of time for questions because I want to take them. I want to see, what you all might have questions about. So how do you know, one of the questions is, how do you know how many participants are needed? Okay, I have a lot of questions in here. Let me see. I'm going to take them from the most recent to up, okay? Because that's what I saw just pop on my screen. Now I have the whole chat here, but I'm going to take your questions. So the one question is, how do you know how many participants are needed for qualitative analysis? Can you come to sort of some kind of power analysis? So the answer is not exactly a power analysis. So what qualitative research is interested in is saturation, okay? Or the point at which when you start to interview people, no more information is required. The problem with that is that you can't budget for saturation, right? You need to have a number, and that's what you're budgeting for. Like when you're putting in grants, when your supervisor asks you, well, I'll grant you 10,000, but how many, what's that going to give you? What are the participant, how many do you need? And those kinds of questions. So you need to have an answer to that. So the answer to that is that it's based on the research question. If it's a small question, like the one that I was talking about with the cognitive debriefing, probably like between 8 and 10 is going to be enough. if you have a medium research question, such as, I'd say a medium question would be maybe the barriers to BMI management, because it was centered around a very specific program. It wasn't a question that would be very broad. Very broad would be something like, what do you do to lose weight? Okay, or what do you do to maintain your weight? That's a very broad question. That would need a lot more participants. So the medium, I think there were actually 25 to 30 participants in this medium question. So sometimes you start hearing, just from my experience in doing this, 20 is what's the recommended that you start with for a medium size project. So I usually budget for 25. That way, if I need a little bit more, that's about right. And if it's a very large study, like, you know, you're trying to figure out, tell me about your diagnosis and what that was like, you could spend upwards of 60 people within that. So it's based on the depth of your research question. The more simple the question, the less people you need. The more complicated the question and broad, the more people you need. Did I say that right? Yes. The more people you need, the more broad the question, and the narrower the question, the less people that you need. So there's not a hard and fast rule. You can't just run a power analysis like we do, you know, in stats. Are these services available for students? So thank you. So yes, they are available for students if your supervisor or your faculty mentor agrees to it. So we do serve faculty, but if you're a student, if you have a faculty member who has the resources to use our services and wants to give them to you as a student, we can go through them to help you. So we do have some MSR students, the student medical student research. We also have students in the MPH and Dr. PH program, but we can't just take students. We have to work through faculty. That's the way this program, the fee-for-service, works as a core. Let me go up a second. Okay. So I'm just going to take them as they're showing up on the screen. Okay. And you can help, if you can help me, Ellie, just, or, you know, navigate this. I'm going to do this one by Timothy. We do a lot of data collection via smartphone or web. Yeah, definitely. And prompted text, video, audio. Yes. Imagine a daily video. Yep, I do that. Electronic, EMAs. So the participant has to talk about, say, their addiction recovery. Two questions were, are there approaches that are suited to that kind of non-interactive data collection? Yes. And I will answer that. And can you talk a little bit about using qualitative methods to understand change across time? Oh, very good. Okay, so yes, I can answer both those. There are approaches that are suited to that. So if the participant is actually entering the data, such as on an ecological momentary assessment or some other way like that, we have something called diametrics, I think it's called. It's a way of collecting data from participants in the moment when they sense that a hypoglycemic event is coming on. And what it does is it asks a whole bunch of questions, a series of questions, both quantitative, and then there are open-ended responses, which sounds like something like what you're talking about. And so we actually do use more of a thematic approach when using these data, because we're trying to find out, or we might even use a combination, because we want to find out, let's see, for content analysis, like what were the symptoms that you were having? And although there's a checklist, there's also like, can you describe specifically your symptom? So that is attached to one of those tick boxes, right? So someone ticks sweating, for instance, but then we have them talk about, I was so sweaty that I felt like I was wrapped in saran wrap with my clothes because it was just they were clinging to me. A lot more interesting than just sweaty, right? So the qualitative data give you all this depth, but how do you actually analyze those? I would probably use more of a content analysis approach with those kinds of things because there's such a clearly defined already category, such as sweating, or let's say the category is actually hypoglycemic symptoms. And then there might be, the codes might be set up according to the different tick boxes that you have. And then how many did you have? And then what are the qualitative data that describe those codes? It's still rather simple because it's very guided, very structured. I would probably use a content analysis for that, but then there may be stories that they tell within there that are broader than just my symptoms or what, maybe what I did for my hypoglycemia, that might be joining more into a thematic analysis rather than just content, because the themes might be something like, I saw my provider, I asked my spouse or partner for help, I used glucagon, I ate or drank something. There's going to be a lot more responses to something like that. And that might work with the thematic analysis piece of it. So it might be more thematic than it is content. You have to kind of look at the exact research question and what you're doing to be able to determine that. But that's the difference kind of between the two of those. And then change across time. So basically it's, we have longitudinal studies with qualitative work where we do, sometimes we map them out. This is where I find software to be very helpful as well, because it will pull changes in not only statistical data that we might be collecting with surveys, but also the qualitative data and how people are changing. So I'd have to probably see the question and that kind of thing, but we use a timeline process. And we say at time point 1, this person was here and they were feeling this way about their, let me just say again, about their weight. Let's say that their barrier was that they had not access to get to the grocery store. Okay. Let's say that was a barrier to BMI management. We had determined that as some kind of theme. And now what we're doing is we're trying to see, has that improved across time? So they come for study visit 1, let's say, for instance, and we find out, we do their weight, we do all this stuff. We also find out from them what are their largest barriers and what have they done in the past that may have contributed to success. We implement maybe one of those, right? We implement one of those things to find out about, okay, you're having a problem with access. Who can you ask to be able to help you get to the grocery store? Do you know about any kinds of, bus in the area or ways to get to the market? Are you aware that there's other ways that you can get, food? Do you have the means to get that kind of food? So we would ask all those kinds of questions. We might implement one of those things. And then in time 2, we'd see, okay, what happened? Were you able to do this? And we could track across time. We would probably set up something maybe even in REDCap for that. And then we can export that to a max QDA or an in vivo file. So it's usually in conjunction with some kind of quantitative data, such as a time point or an intervention that occurred. And there's some kind of quantitative event or quantitative survey that's completed. And then we want to also see qualitatively, how did that change, or even why did that change from, point 1 to point 2. So next question. I can't see it actually. There's a bunch.
think you addressed them. I don't see any unless they're direct.
No more? There was something about a theoretical.
Oh, yes. Is there a particular qualitative research theoretical framework that is well suited for exploring translational science related questions?
Wow, that's a good question. If we do have a theoretical framework, I'll answer that. But if we do, then you use a slightly different way of coding. So yes, I'm trying to think of if there are theoretical frameworks. I mean, I've used the theory of change, I don't know how many times, because I do a lot of things where we're trying to get people to move from one stage to another throughout time. It's not really so much translational science as it is, again, what is the research question and what is the approach that would best answer the question? I'm trying to think of any theoretical. We've also done some things with critical theory, critical race theory, and I'm trying to think how that, it wasn't so much that it's tied to any kind of research, right? It could be, you could take critical race theory, for instance, and apply that to a quantitative assessment. You could apply that to a qualitative or mixed methods assessment. So it's not so much that there's one that applies to clinical and translational research as it is the question that you're asking, is that clinical and translational? If the question that you're asking is clinical and translational, then the theoretical framework that fits with that you're trying to demonstrate with that question should fit the question, and not so much whether it's translational or not, because the decision about translational research is made at the point of the research question and how you're thinking about it. And if you view that it's going to be translational, then get the framework or the theoretical framework that fits that question. With that said, the way that changes the coding a little bit or a lot is that there's three kinds of coding. One is inductive, which is what I was referring to throughout this presentation. There is another way, it's deductive or a priori coding, and then there's the mixed where you use both, okay? So the a priori coding is something that you could use when you have a firm theoretical framework. So let's say you're using Kubler-Ross's stages of grief, for instance. You have a study and you already know what the stages of grief are. You could use those as your categories, and then you would probably have codes underneath those categories that are based on what the individual has said. And you could code according to the a priori code book. So that's where you already are you are coding according to that theoretical framework. Another way you can code, which is not, I don't use it a lot, but I do sometimes as a starting point, is to code according to the interview guide, because you've already thought about how the different interview questions are going to relate to your larger research question. You've already thought about that. So in your mind, you're kind of thinking about, how do I think these codes are going to, well, you can almost see how the codes sort of emerge as you're going through the research, as you're going through the interview questions. You might develop codes that are mirroring the interview questions, and those could also be considered a priori. Usually where that, I don't know that a lot of that happens, because we usually use a mixture of those. We use, okay, here's the interview questions that we said belong to these these are the codes for those interview questions, but we're going to add our own. And that would be a mixed, that would be using both the mix of the a priori codes and the inductive codes. So how do I report that change over time then? Is it a narrative account? Do you see the graphs or other visualizations? So I do, there is a graph in the software program where you can see the changes over time in the coding. You know, I'm trying to think of a time where I only used qualitative work, only qualitative, to capture changes over time. I'm trying to think how I would do that if it were not connected to some, you could write a narrative, like you had said. You could write a narrative and say, this is what this person did in time 1, this is what they did in time 2, but it's very bulky and difficult to write about. I would think it would be much easier to do a mixed method study with this kind of thing, where you have a certain event, or you have a number on a scale of, 1 to 5, 5 being most likely, what the behavior that you have decided that you want to engage in as your intention is that you are going to find someone to call to take you to the grocery store because you have a cousin who is out of work, and to do that, you're going to exchange them by buying, $5 of their groceries. That might be what you say that you're going to change over time, right? So what we'll do is we'll track your weight. Okay. And that may not be it. So qualitative research is not a causation, right? We can't really determine a causation with qualitative research, but we can understand, okay, what are the things that this person is doing that are improving the time point at each time point. So I don't think, I do that in conjunction with quantitative data because it's just a lot easier to sometimes just put a number, but then the explanation of the narrative of why that person chose that number. But the numbers are actually what I'm kind of tracking over time, but it's the narrative that then is helping to reinforce that number. So it's difficult to do without a mixed methods. I'm not saying you couldn't ever, but it would be very difficult to report in a concise way the change that you're seeing over time with using just narratives alone. AI, yeah. So we're working on this, right? The AI that's available on most, I don't know if you've ever tried to record a Zoom. Recording is fine for words, for audio and for video, but it's not so great if you ever used Zoom Translate. It's horrid. It's horrible, right? It doesn't translate very well. It's just not good. So we don't use that as a way to translate. So our AI is still not up to date, although I am working with some AI technology, especially if you don't know Simon, SY-MIN Chen, CHEN, in Public Health Sciences. She's very much into automating qualitative data. And so we've been working together on this one hypoglycemic unawareness study. It's just started. In fact, technically it doesn't even start until next year, but we've been meeting as a group to try to discuss how are we going to be able to automate these data better. And we want to do that, especially with the EMA data, because there's like 160 participants in this study. There's 4 arms. There's 5 countries, I think. It's a really large and convoluted study. And so we would rather have AI do that, but we're looking at options. So I don't have any great responses right now to AI. And Vivo has not worked on any of them at all. They're way behind. So if you do see any, it's going to come from Max QDA as a way to categorize them. I thought of this like 5 years ago. I thought I can make like $5 million if I could figure out how to have the computer software look through the words and actually do this. So I don't know of any AI that's perfected yet. But it sure makes a lot of sense. And I'm going to see what Simon and I are coming up with to see. It would be very project specific, but maybe there would be applications for other uses. So that's my time.
That's wonderful. Thank you so much, Dr. Stuckey. We really appreciate your presentation today, and we had some great engagement from participants. So thank you all for your questions. That takes us to our 1 o'clock. So you'll receive a follow-up with the recording and the copy of the slides that Dr. Stuckey presented today. Thank you so much for attending. We hope to see you at September's TSS seminar.
Thank you.